Bismillahirrahmanirrahim. Today we are going to learn about the lacrimal gland and lacrimal pathway. A lacrimal gland is an exocrine gland that is present below the upper eyelid and that is responsible for the secretion of lacrimal fluid or tears. This is the first slide. In this slide we can see that this whole pathway represents the pathway of lacrimal gland or lacrimal secretion. To know about the lacrimal gland and lacrimal secretion, we are going to learn a few terminologies. The lateral side of the eye, this is the lateral side of the eye. This lateral side of the eye is called, this edge is called lateral commissure. This is called lateral commissure. While this median side, this median side of the eye, where the two palpebra or two eyelid meet, that point is called median commissure. I'm going to write it. One is a lateral commissure, just like the commissure of lips, and the other is median commissure. Now the gap in between the upper and lower eyelid, the whole gap, this gap is called, this is called palpebral fissure. This is called palpebral fissure. Palpebral fissure. So the lateral side of the eye where the upper and lower eyelid meet, that edge or that point is called lateral commissure, and the median point where the upper eyelid and lower eyelid meet, that is called median commissure. Now the gap in between the upper and lower eyelid is called palpebral fissure, just like the fissure of the brain, just like the fissure of the lips, just like the fissure throughout the body. Now coming towards the lacrimal gland, this represents the lacrimal gland. Lacrimal gland is just like the size and shape of an almond. This lacrimal gland is connected with the eye or with the cornea with the help of ducts, and these ducts are called lacrimal ducts. I'm going to write it. The lacrimal gland and the lacrimal ducts. Lacrimal ducts may be up to 30 in number, that connect the lacrimal gland with the eye, and that is responsible for the passage of lacrimal fluid from the lacrimal gland to the eye. So the lacrimal fluid is produced inside this lacrimal gland and that is transferred to the eye with the help of lacrimal duct. Now this lacrimal fluid or tear comes into the eye, and this washes the dust particle and washes the microbes, etc. in the eye, and this tear come to this midpoint. When this tear come to this area, this tear or this lacrimal fluid is absorbed into this canal. It's also absorbed into this canal. The upper canal is over here. This is called superior canaliculi and this is called inferior canaliculi. In between the superior and inferior canaliculi there is a caruncle. This is lacrimal caruncle. Lacrimal caruncle. This lacrimal caruncle is having a tube, a duct above this lacrimal caruncle, that is called superior canaliculi, and this duct is called inferior canaliculi. Now coming towards the next one. So the tear come from this gland to the eye. From the eye it goes toward these canaliculi, and from these canaliculi this tear or this lacrimal fluid is transferred to this sac, and this sac is called lacrimal sac. lacrimal sac is actually present adjacent with the upper part of the nose, uh, near the eye, near the median commissure. This lacrimal sac is present, and this lacrimal sac is connected. Again, this is connected with the nose, with the nasal cavity of the nose. The nasal cavity of the nose is having three turbinates: the superior turbinate, the median turbinate, and inferior turbinate. So this lacrimal sac is connected with the inferior turbinate. I have written this. This is the inferior turbinate of the nose, and this inferior turbinate of the nose is connected with this lacrimal sac with the help of a duct. This duct is called nasolacrimal duct. This is called nasolacrimal duct. Now what happens? Once again, the lacrimal fluid is produced or synthesized inside this lacrimal gland, and this lacrimal fluid is transferred to the eye with the help of lacrimal ducts. And this lacrimal fluid washes the dust particles and the microbes, because this contains the lysozymes and many other neutralizing agents. This washes the eye and comes toward the midpoint of the eye. When this tear come towards eye, toward this canaliculi, this is transferred toward the lacrimal sac through the upper to the superior canaliculi and inferior canaliculi. This lacrimal sac is there for the for the storage of lacrimal fluid. When this get filled, this is transferred to the lacrimal nasolacrimal duct. So this fluid or this tear goes through the nasolacrimal duct to the wall of the inferior turbinate of the nasal cavity. So what is the function of this tear inside the inferior turbinate? It keep the environment of the inferior turbinate wet. It keep the inferior turbinate environment moist. It keep the wall of the inferior turbinate wet to trap the dust particle or the microorganism which goes through this inferior turbinate into the lungs. So this is there to filter the air, to not allow the dust particle or microorganism to go into the lungs through the nasal cavity. So the nasal cavity is always wet. The inferior turbinate of the nasal cavity is always wet due to the presence of it, due to the presence of the tear or presence of the presence of the lacrimal fluid on the wall of the inferior turbinate. Now, sometime it happens that this nasolacrimal duct get blocked. When this nasolacrimal duct get blocked, what happens? The lacrimal fluid get enter into this lacrimal sac, but this is unable to transfer the lacrimal fluid into the inferior turbinate. So there is inflammation of nasolacrimal sac happen, and this inflammation can be seen. You have seen in various patients that this point of the eye, this point adjacent to the eye, becomes swelled. So this condition, when the nasolacrimal duct get blocked, and this the swelling of this nasolacrimal or this lacrimal sac happens, the tear are unable to enter this lacrimal duct anymore. So what happened? The tear get out of or drip out of the eye through the eyelashes, through the lower eyelid. So this the tear is no more unable to, the tear is no more able to cross the this canaliculi toward this lacrimal sac, and this is also unable to go to the inferior turbinate. So this condition, when the blockade of the nasolacrimal duct happen, this condition is called dacryocystitis. Dacryocystitis. You have seen a lot of I'm going to show you in this diagram. This represent the lacrimal gland. This is at the inferior, this is at the dorsal portion of the upper eyelid. You have seen, and this lacrimal gland is connected with this point. This is connected with cornea with the help of what? With the help of lacrimal ducts. Now, sometime you have seen, or you will have seen, this kid is this kid is laying on lateral position. You can also call it recumbent position. When sometime you get lie in the bed, when you lie in the bed on lateral position, what happened, and you keep your eyes open, what happened to your eyes? The cycle of the lacrimal pathway, the cycle of the lacrimal gland, or the lacrimal fluid, which is secreted from the lacrimal gland over here. Lacrimal gland is over here, and from this lacrimal gland, the lacrimal fluid is secreted into the eye, and this is absorbed towards the nose, into the lacrimal sac. So the lacrimal secretion or lacrimal pathway of this right eye is normal, because the lacrimal secretion goes to the eye, and from the eye it goes to the nose. But the lacrimal secretion over here is obstructed. How the lacrimal secretion is obstructed? You should focus on this point, that when the lacrimal gland secrete the lacrimal fluid to the eye, what happens? This cannot go upward against the gravity. This cannot go into the canaliculi to go to the lacrimal sac. So what happened to the lacrimal fluid? This lacrimal fluid drip out of the eye through the lateral commissure. This dripping out of the tear, or this dripping out of the lacrimal fluid, is due to the blockade of this pathway, due to what? Due to the or the halting of this pathway, due to what? Due to the gravitational force, due to the position of the eye. When your eyes are closed, then this dripping do not happen, because the eyelid do not allow the tear to get out of the eye. So the normal cycle or normal pathway of the lacrimal fluid is carried on. The sole function, or the function of the lacrimal fluid, is to wash out the microorganism from the eye, and also to filter the air and the inferior turbinate of the nose. Some of the fluid is also absorbed over here with the help of capillaries over here, and these capillaries once again recycle this fluid towards this gland. But this rarely happens. The 90% of the fluid is evaporated from the inferior turbinate, and the 90% of the fluid is also evaporated from this eye. But this is produced in very minute quantity inside the this lacrimal gland. About less than 2 ml of fluid is produced daily. But sometimes when this eye come in contact with a nasty substance, when this eye come in contact with an irritant, what happens? The parasympathetic nervous system is activated, and it activate this lacrimal gland to secrete large quantity of tears. So the function of this pathway, the function of this lacrimal fluid, is to wash out the microorganisms with the help of lysozymes, which are present inside this gland, and the dust particle, and also to accumulate the dust particle towards the caruncle, towards the lacrimal caruncle, and then we remove this the dust particle from here when that's